All right, men, this one is for you if you are struggling or feeling frustrated with intimacy in your relationship. Well, Andrew is back with us from South Bay Medical, wants to talk about how important communication is, making sure that you are talking about it. And the best news is there's actually something that can be done about it. And it doesn't require pills and surgery and all of that. Andrew, good to see you again.
Hey, thanks for having me on. And yes, if there's anybody out there frustrated in the bedroom, we're talking about erectile dysfunction, you are going to want to watch this segment. South Bay Medical Clinic uses an advanced form of something called acoustic wave therapy. What that does is it opens up and regrows blood vessels. We know that erectile dysfunction is a blood flow problem. You're not getting enough blood flow. That is what these treatments correct. So here's the bottom line. We have a treatment for ED. It's non-invasive, not painful. Treatments are about 10 minutes a piece. You do a few of them, and you can get the blood flowing properly. You can eliminate your erectile dysfunction. No pills, no injections, no surgery. This truly is a medical breakthrough, and we have helped thousands of men and couples get back to normal and natural spontaneity in the bedroom.
You know, it's interesting, and you're joining our show a lot, but there's a reason for it because I think the message still needs to be put out there because it's still relatively new. I think people assume, couples assume, men assume that the only way to fix this is through pills. But the results are showing that's not the case.
Yeah, that's exactly right. Couples, men, they think that the pill is the only thing. And I hate to say this, even some doctors think this is the only way. I would invite you to look at a study from Cambridge that we have on the science page at southbaymedicalclinic.com showing a bunch of men went through these treatments. And by the way, they took a pool of guys that were no longer responding to pills. So the pills weren't even working. They probably had severe erectile dysfunction. And at the end of their study, they said all men experienced an increase in blood flow. So yes, the FDA registered this in 2011, relatively new in the medical world, but it is helping a lot of guys. They go through our treatments, they get off the pill, they get back to their younger years, the ED goes away, and they kind of say, I wish I would have done this sooner.
Well, and I'd imagine you hear that a lot because let's be honest, men typically, when it comes to medical issues or health issues, they're generally not the first ones to say, oh, okay, yes, I want to do something about this. How do you make sure that men feel comfortable in, number one, making the phone call and then also coming in for that initial visit and consultation?
Boy, this is a great question to be asking. Men are a little bit hesitant when it comes to these type of things, and ED maybe even more. You will come in, you will meet with an all-male staff, a male doctor. It's more normal than you think. And here's what you got to think about. The average guy does a few of our treatments, they're 10 minutes, over about 2 weeks. So think about how pain-free that is compared to taking the pill for the rest of your life, compared to injections for the rest of your life. I can assure you this is so much less embarrassing than continuing to struggle. The embarrassing part about erectile dysfunction is, excuse me, honey, let me go take a pill. We're eliminating that. So we are going to improve your life, improve your relationship, get rid of the erectile dysfunction so that the blood flows properly and you get your life back in the bedroom.
So how does someone find out if they are a good candidate? Because obviously this wouldn't work for every single buddy, but how do you find out if you're a good candidate?
Well, we're going to give you a little special offer at the end of this segment, which will include a doctor's screening. You'll come in, you'll have an exam, we'll go over medical history, we'll conduct an ultrasound to test your blood vessels. And you're right, most guys are a good candidate. Not everybody. We're going to look at that and make sure you're a good candidate prior to starting.
All right. Well, let's go ahead and end with that special offer this morning. And again, to put the number up to make sure that people know to call today.
Yes, call the number on your screen right now. We are giving away so much for free. Put a stop to your erectile dysfunction. To those that call right now, we will do that assessment that I mentioned, the screening and the blood flow ultrasound with our doctor at no charge. We'll also throw in a little special gift that is proven to produce instant results in the bedroom. It's quite fun. Couples love it. We're going to do that all for free to those that call us right now.
All right. Well, Andrew, thank you so much. We really appreciate your time this morning. We'll talk to you again soon.